Well, hello and welcome back to the OHSU Parkinson Center Ask the Doc. And today we're going to ask the physician assistant. We have with us Shannon Anderson, and she is our physician assistant working as our deep brain stimulation coordinator. So Shannon, tell us about deep brain stimulation. What is it?
So deep brain stimulation is one of the therapies we have to manage the symptoms of Parkinson's disease. It's a surgical procedure and it involves the delivery of high-frequency stimulation to deep nuclei in the brain, and there's two specific targets we use in Parkinson's disease. So the components of a deep brain stimulator, there's three main components. The first is the brain electrode, which looks like this. And what the surgeon does is he places this electrode down into your brain. Then there's the lead extension. This gets connected up top, and then they thread it underneath the patient's skin, behind the ear, and then down over the clavicle. And then that gets attached to this pulse generator that just rests typically in the chest. The whole system is under the skin, and basically what that does is that manages those symptoms of Parkinson's disease.
Well, thanks Shannon. Thanks for that great overview of DBS. So when should the provider consider referring a patient for DBS? When should I go see my doctor, and when should I see a surgeon?
Mm-hmm. So when patients are first diagnosed with Parkinson's disease, the primary management is through medications. And eventually most patients end up on a medication called levodopa or carbidopa-levodopa. And what that does is that helps with someone's slowness or their bradykinesia, their stiffness or rigidity, and their tremor. And as time goes on, that person requires more and more levodopa. So the dose goes up, but also the frequency or how often you're taking that medication increases over time. So basically what happens is someone wakes up in the morning, they're slow and stiff, they take their medication, they feel a little bit looser, a little bit more mobility, but then it wears off and they go back to slow and stiff. Additionally, on that top end of that, someone can experience a symptom called dyskinesias, which are abnormal extra movements. That's a side effect of the medication. And so they get on this roller coaster of off state or slow stiff, and then an on state marked by too much movement. And so once we see someone kind of heading in that direction in terms of their medications, we think that'd be a great time for you to talk to your provider about a referral to a DBS center to consider whether or not surgery is a good idea for you.
Well, boy, Shannon, this sounds like it could be a great procedure for some people. Are there any risks that people should be aware of?
So there's two different ways to think about risks. One is the risks of the procedure itself. The main things to think about there are a risk of a bleed in the brain, a risk of a stroke, or risk of infection. The risks of the actual procedure are quite low, usually between 1 and 3%, and certainly they're different from center to center, so I would encourage you to talk to your neurosurgeon about their specific results with this surgery. The other way to think about risks of this procedure are what effects does it have on the other symptoms of Parkinson's disease. So certainly DBS is very helpful for the bradykinesia, the rigidity, the tremor, and the dyskinesias you get from levodopa, but there are a lot of other symptoms with Parkinson's disease. So those ones that are most at risk for this surgery are stuff down the middle. So thinking and memory or your cognition, speech and swallow function, or your gait and balance. Not everyone is going to have those symptoms negatively affected by DBS, and DBS centers typically have an evaluation process that looks at those symptoms more specifically to give you an idea of what your actual risk of the procedure would be.
Wow, DBS is very complicated. Well, I know that OHSU has been a pioneer for over 25 years. How has the program evolved over all this time?
So there have actually been a couple really important advances in how we do deep brain stimulation and how we evaluate who's going to be a good candidate and therefore get a good outcome as a result of having the surgery. The first is how we perform the surgery, the actual procedure. The one way is what's called awake DBS, or using microelectrode recording to find the target. And the other that was developed here at OHSU is a sleep DBS, or in other words, using imaging and having the procedure under general anesthesia. Another major advancement that OHSU has incorporated into our evaluation is using a lot of our allied health team and helping us figure out what those risks and benefits are to our patients. So We have a speech pathologist, a neuropsychologist, a physical therapist, in addition to our movement disorder trained neurologist and our neurosurgery team, all involved in evaluating a patient's candidacy.
Well, thanks, Shannon. Thanks for this great information.
You're welcome.
Know that if you have any specific questions about your own concerns, please contact your own providers or ask to get a consultation with us. Thank you again for watching our Ask the Doc series, which can be found usually on Facebook or YouTube. And if you have any other questions you'd like us to address, please send us an email at pco@ohsu.edu. Thanks again.